Hello everyone, this is Ebony again. Today, let's talk about penicillin VK. If you are a parent or an individual with sickle cell disease, you would know that your doctor prescribed you penicillin VK 125 milligrams twice a day. This penicillin is supposed to be given to prevent infections, especially those bad ones like streptococcuses. So the idea is to take this penicillin to prevent you from getting really bad infections that can cause your spleen to become enlarged or to make you even more sicker having sickle cell disease. Ingesting penicillin, it's understood that the attempt was to prevent further complications and further bacterial infections, etc. But what they're not talking about is how this penicillin VK is negatively affecting us. Taking an antibiotic, penicillin, from the ages of 2 months old up until 5 to 6 years old negatively affects the gut flora. This puts your gut at risk for dysbiosis, meaning you have more bad bacteria versus good bacteria. When this happens, it causes an alteration in how you absorb nutrients. So it puts the sickle cell individual at risk for B1, B9, B12 deficiencies. And also it impacts your serotonin that's made in your gut. So it puts you at risk for mental illnesses and neuropsychiatric disorders. In plain man's terms, taking penicillin VK, although it's in a small, minute dose for the span of 2 months old to 6 years old, can be causing your child to be having difficulty absorbing nutrients, which we all know when you have sickle cell, they want you to take all these folic acid every day. You got to check your B12 levels. Not knowing that the same penicillin VK they're having us take is making us not able to absorb the nutrients in our gut. Secondly, already having sickle cell disease, we know that it's psychiatric. It hits us mentally. We have a difficult time functioning. We're stressed out. We're depressed. We're anxious. You know, the world looks at us differently. And with that, taking the penicillin VK is compounding the expression of how we're feeling, because now the serotonin is not going up to your brain to make you feel happy, etc. So now we're having children with sickle cell disease that are depressed, that are having social issues, talking and communicating or being around other people. They're having ADHD, even mental illnesses. And this is all due to taking penicillin V. I'm not making this up. The medical literature is there. When my son was diagnosed, I stopped giving him penicillin VK. Once I started to read into the literature, I opted for a more natural approach. The National Institutes of Health, who came up with this penicillin VK to help the sickle cell population, I believe that it was their intention for it to be helpful. But as studies continue to roll out over the years, nobody's taking the time to reassess the benefits. And right now, being a medical provider, I feel like the risks outweigh the benefits. So for me, I don't subscribe for penicillin VK.